If your child is often distracted, constantly on the go, or finds it really hard to focus, you might have wondered whether it could be ADHD. I'm Dr. O'Donovan, and attention deficit hyperactivity disorder, or ADHD, is something we hear a lot about, but it is still widely misunderstood. And for families living with it, that can be really frustrating. In this video, I'm going to walk you through what ADHD is, how it presents in children, what causes it, how it's diagnosed and treated, and what the long-term outlook might be. Finally, I'll also cover some helpful resources which you might want to check out in your own time, which I've linked in the description box of this video. So what is ADHD in children? Well, ADHD is a behavioural condition that affects a child's ability to focus, manage their impulses, and stay still. It's a persistent problem, not something that comes and goes, or something a child can just switch off with willpower. Now, it usually appears in one of three ways. Firstly, inattention. This is difficulty focusing, being easily distracted or forgetful. Secondly, hyperactivity impulsivity, which is being constantly active, unable to sit still, blurting out answers or interrupting, or a combination of both. Now, it's important to remember ADHD is not the same as being naughty or disruptive. Children with ADHD often want to behave well, but struggle with self-control and attention in ways that are different to other kids of their age. Now, what are the symptoms of ADHD in children? Well, symptoms usually show up in more than one place, like at school, at home, or in social situations, and they're often noticed before a child turns 12. In children with hyperactive or impulsive traits, you might see fidgeting, tapping, or squirming in their seat, trouble playing quietly, talking non-stop or interrupting often, difficulty waiting their turn. In children with inattentive traits, you might notice getting easily distracted, struggling to stay on task, losing things often like school books, toys, or homework, making careless mistakes or forgetting instructions, or having trouble organising things. Now, some children, like I mentioned, have combined ADHD, which means that they show features of both types. It's also worth knowing that ADHD often overlaps with other challenges like anxiety, depression, learning difficulties, dyslexia, or poor coordination. So how common is ADHD? Well, ADHD is thought to affect around 1 in 20 children in the UK, depending on where you read your sources, though it may be even more common. Now, it's diagnosed more often in boys than girls, partly because boys are more likely to show hyperactivity behaviour, which is more noticeable in a classroom setting. Now, girls are sometimes missed or misdiagnosed, especially if they're quiet or inattentive, and that's why it's important to understand that ADHD can look different in every child. And although ADHD is often picked up in children aged 3 to 7, it's not unusual for symptoms to go unrecognised until much later, sometimes even into adulthood. So what causes ADHD in children? Well, to be honest, there's no single cause of ADHD, but several things might increase a child's risk. These include genetics, so ADHD tends to run in families, so if a parent or a sibling has it, a child may be more likely to have it too. It could also be pregnancy-related factors, so smoking, alcohol, or drug use during pregnancy can raise the risk. Birth complications such as low birth weight or lack of oxygen during labour, or severe early neglect. Although this is rare, extreme deprivation can contribute. But it's important to be clear that ADHD is not caused by poor parenting, too much screen time, or diet alone. These things might make behaviours more noticeable, but they don't cause the condition. So how is ADHD diagnosed? Well, there is no simple test for ADHD like a blood test or brain scan. Instead, diagnosis involves a detailed assessment by a specialist. That might be a paediatrician, a child psychiatrist, or a member of a child mental health team. They'll typically ask about your child's behaviour, both at home and at school, and may request input from teachers. They want to know how long the symptoms have been present, how often they happen, and whether they affect your child's ability to function day to day. Now, in the UK, to be diagnosed with ADHD, symptoms must start before the age of 12, be present in more than one setting, such as school and at home, last for at least 6 months, affect daily life significantly, and not be better explained by another condition like anxiety, autism, or hearing loss. Now, sometimes other tests might be needed to rule out other causes, such as checking hearing or potentially doing blood tests. So how is ADHD treated? Well, treatment depends on the child's age and how severe the symptoms are. In many cases, support doesn't begin with medication. It actually helps with helping parents and families understand the condition, as well as tips on how to manage it. Now, non-medicine approaches for children with mild to moderate ADHD, the first step is often a parent training program. These programs help you to learn strategies to manage behavior more effectively, understand what your child is experiencing, and improve communication. And these can be very, very helpful. Now, some children are also offered group therapy, social skills training, or family therapy to support behavior and emotional well-being. Now, these approaches don't mean that you're doing something wrong as a parent. They're about giving you and your child extra tools. Now, if symptoms are more severe or they don't improve with non-medicine treatments, medication may be recommended. Now, the most commonly prescribed medication is methylphenidate, which you might have heard being referred to by its brand names including Ritalin. Now, this medication helps to increase dopamine in parts of the brain responsible for attention as well as impulse control. It's also important to note that there are other medication options that are available, but you should always discuss these with your child's doctor or specialist care team. It's also important to know that whilst medicines don't cure ADHD, they can make a big difference, often helping children to concentrate better, feel calmer, and manage everyday tasks more easily. Most side effects are mild and temporary, such as poor appetite or difficulty sleeping, but like with any medication, it's always important to be aware of any potential side effects. You should always read the information leaflet that comes with the medication before your child takes it, and also have a full and open discussion with your child's doctor. Medication is usually reviewed every year to make sure that it is still helpful and needed, especially during the teenage years. And it is worth stressing that medication should be combined with the other options that are non-medication options that we discussed earlier. So what about diet and ADHD? Well, there's no strong evidence that diet causes ADHD, but in some children, certain foods or additives may affect behavior. Some families try omega-3 supplements or eliminate things like artificial colours, and while this can help in specific cases, it's not right for everyone, and very restrictive diets can carry risks, especially in growing children. So if you think diet might be influencing your child's behaviour, current NICE guidance in the UK is to speak to your GP and ask for a referral to a qualified dietitian. They can guide you safely and ensure that your child gets the nutrients they need. Do not try to set a strict, restrictive diet for your child by yourself. In general, children with ADHD generally benefit from a balanced diet, good sleep, regular physical activity, and a consistent daily routine. And I think that last point is really important. So what about older children and adults? Well, as children grow, their symptoms may change. Hyperactivity often lessens, but difficulties with focus and organisation can continue. For older children and teenagers, cognitive behavioural therapy or CBT, coaching or social skills training can be useful. Now, these approaches typically help young people understand their behaviour, build confidence, and develop coping strategies for things like school and relationships. In adults, treatment often includes both medication as well as psychological support, along with help in areas like work, education, and managing responsibilities. And I've included a link to a video I've made specifically on ADHD in adults in the description box of this video. So in terms of the outlook, children with the right support can thrive, but without the right support, it can lead to increased risk of things like exclusion, difficulties with friendships, or even anxiety and depression. Research also shows a link between untreated ADHD and later issues in later life in adulthood with employment or risky behaviours. Now, the good news is that early support does work. With a proper diagnosis and a combination of strategies at home, school, and through healthcare, many children go on to lead fulfilling and independent lives. So ADHD is a real and complex condition, not a sign of bad behaviour or poor parenting. It can affect many areas of a child's life, but it's also something that can be managed. And I want you to take that message home, especially when it's recognised early and treated with care. If you're concerned about your child, please do speak to your GP, the family medicine doctor, or even their school. Support is available and you're not alone. If you'd like to learn more about ADHD, then I can recommend Young Minds, which is based in the UK, a really helpful resource for parents and carers with practical advice and support services, as well as the patient.info website, which offers clear, evidence-based information on ADHD symptoms, diagnosis and treatment. I've included these and a whole host of other links in the description box of this video. If you'd like to leave a comment below, if you or someone in your family has ADHD and you'd like to share your story or tips to help others who are watching this video, please do so. I know that typically people find that very, very helpful. And if you did find this video helpful, why not check out this video next?